neurofibromatosis. Okay, we should know that we have two types of neurofibromatosis, type 1 and type 2. Okay, so we will start. Let me zoom 1 second. Okay, I will zoom in. So let's read the case. So a patient presented with café au lait spots, a light brown pigment on his skin, plus brown pigment in the axilla, and a tuber-like skin growth. Tuber-like, this is the tuber-like skin growth. I will not post the picture of a real neurofibromatosis. You can just Google it. Google it and you'll never forget the picture of neurofibromatosis, okay, of the tuber-like skin growth. It's very characteristic. So a tuber-like growth, skin growth, plus episodic headache and severe hypertension. All of the symptoms are mentioned here that will lead us to diagnose neurofibromatosis. Okay, let's start by the first one. So he said the tuber-like skin growth. I will advise you to see the picture, to look it up in Google. A picture for neurofibroma. The second one, patients with neurofibromatosis will have optic nerve gliomas plus leash nodules in the eye. This is not the picture of optic nerve glioma, neither leash nodules. You can see it in Google. I just like the color of the eye, the blue color. I think I'm obsessed with the blue. It's a very peaceful color. So you can Google this up, optic nerve glioma plus leash nodules. The third information about neurofibromatosis is that it comes with a pheochromocytoma, and we can know this by in the case, like if you pay attention in the case, he mentioned that he's having episodic headache plus severe hypertension. These symptoms together equals to pheochromocytoma. Patients with the pheochromocytoma, they will have a tumor here, okay, and this tumor will secrete in episode, not in continuous manner. In episode, catecholamines will cause severe hypertension plus episodic headache that comes with the hypertension. So pheochromocytoma comes with a neurofibromatosis type 1. And here is a picture for meningioma. This is a meningioma. How to know this is a meningioma? The most important thing about meningioma that it comes related to the meninges. So we can't see a real tail here, but in other pictures it will be very clear that it's have a tail, like it, because it's attached to the meninges. You can imagine it like this. So there is a tail and there is a ball, like the meningioma, the tumor. Okay. Another information that patients with a neurofibromatosis type 2, not type 1, they will have bilateral acoustic neuromas. It's and we should know the inheritance. It is autosomal dominant. The gene for neurofibromatosis type 1 is called neurofibroma, and the gene for neurofibromatosis type 2 is called Merlin gene. The chromosome for neurofibromatosis type 1, the problem with the chromosome 17, but in case of a neurofibromatosis type 2 is 22. So it's neurofibromatosis type 2, problem with the chromosome 22 and with the gene Merlin, and we have bilateral acoustic neuromas. That's neurofibromatosis in a brief. If we know these main things, we will be able to diagnose any case in the USMLE or lab exam. Okay, see you in the next video. Bye bye.